Welcome to Mental Health First Aid. We have a show today. We're going to be talking about chemical dependency. And it's an important aspect because 1 out of 4 of us have a mental health issue. And it could be us. Could be your loved one, could be your neighbor, could be your coworker. And what we're going to be giving you some information here is to try to help you to deal with that. Part of Mental Health First Aid curriculum, we have 5 different portions, and one of the portions is chemical dependency. We have a specialist here today, Beth Sack from Linden Oaks. She's here to talk about it. And Beth, what is some of your background? I mean, what is your credentials, I guess you say?
My credentials are licensed clinical professional counselor, LCPC for short, and then I have I'm a certified addictions counselor. I've been at Linden Oaks 13 years now, and I've been doing this for about 17 years now.
And you're in charge of a certain area, or?
Yes, I'm in charge of the chemical dependency on both our inpatient, which is a detox unit, and then our outpatient programs.
I know when I just started at Linden Oaks, I was able to come by and you helped me out, was able to sit in a little bit to try to build some of my foundation about these issues and stuff. And it was really interesting. You let me sit in a couple of the talk therapies that you do, and that really helped me a lot to understand what you guys are going through. We're going to try to get that out here, also to discuss it a little bit. What is chemical dependency? When we say chemical, what are we talking about?
Sure. Well, chemicals can be various different types of chemicals. The most common chemicals that we see that people are abusing when they come into treatment at Linden Oaks is usually alcohol, marijuana, cocaine, and heroin or opiates. And when we look at chemical dependency, the American Medical Association really looks at it as a disease. And they look at it as a disease because it's progressive and it's chronic. And we can see that in the people that we treat at Linden Oaks, is that it starts off in early stages looking like one thing, and as it continues to develop more, it definitely turns into more of a dependency issue.
Right.
Sometimes initially it starts off with more of an abuse and maybe drinking a little bit too much or binge drinking, and then again looking at dependency.
How can we tell if there's a problem? If there's an issue? I mean, is there something that has to happen to them personally that would fit the criteria of a problem?
Well, some of the criteria that we use in the DSM, which is the Diagnostic and Statistical Manual, we look, first of all, if they have more of a physical dependency, which means they would either have a tolerance or withdrawal. And what those two things mean is tolerance is needing to drink or use more and more to get the same effect. So maybe in the past 2 or 3 beers gave you a nice little buzz, now you need a 6-pack or a 12-pack. So if you're starting to develop a tolerance, we're going to look at that as that being more of a problem for you. And typically when you develop a tolerance, then you'll have withdrawal. So if you're not drinking or using for a period of time, your body might start to have muscle aches, sweats. The shakes is kind of the typical that we see with alcohol sometimes, or people think goes along with alcohol. And so those are some of the symptoms we might see. Some of the other things we look at is even just in your own life, what's being affected. Is your job being affected? Is your relationship being affected? And kind of bottom line is, if you think it might be a problem, it's probably a problem.
You know, we were talking about that with an anxiety show we had here last time, where we discussed if it has something to do with your work, if it's messing with your work, your personal relationships, or your social activities, then something's going on.
Exactly.
And that's what you sort of hit the criteria for that. You mentioned a DSM?
Yes.
What is that? Explain it to us.
That's the Diagnostic Statistical Manual, and I believe they're in process of making the 5th version of that. And that really helps clinicians, and more so doctors, psychiatrists, really be able to identify what specifically a diagnosis might be for somebody.
So is that like a national, or is that international? Or
I believe definitely it's national, and it could also be international.
And that's sort of like the main book that you guys go to try to figure out the black and white of what's going on.
There's certain criteria for substance abuse, for certain substance dependence, substance withdrawal, so that's what we kind of utilize to look at when we diagnose, or the doctors diagnose.
Is it weird, or chemical in alcohol? It's a chemical, right?
Definitely.
I mean, that's what people, like they say drugs, well, alcohol's not a drug. But it is a drug.
It is a drug.
And we sort of, sometimes people have a problem believing that's what it is. I know when I had to deal with parents who had kids who were drinking, or, oh, thank goodness it was just alcohol. It wasn't drugs.
Right.
But it is.
What I like to tell people about that I think is really interesting and people don't realize is we think in our society it's just alcohol. And most people in our society drink at some level, and most of them drink socially and don't have a problem with it.
Right.
And as we look at the continuum, you might look at alcohol, then next might be marijuana, then next might be cocaine, and then heroin. And you look at the continuum and think, oh, I'm glad they're only drinking. But when somebody, if they get to a level of drinking on a very regular basis or daily basis, and they develop that tolerance, when they stop drinking, it's life-threatening. No other substance is life-threatening except benzodiazepines, Xanax, Ativan, those types of substances. They're very similar to alcohol. And so as much as we kind of in our society go along with drinking as being okay,
right.
That's one thing when you stop drinking that you could become deathly ill and have seizures and strokes.
That's one thing that I did learn through our mental health first aid, is that there are two different things coming off of these drugs that can kill you, literally kill you. And one was alcohol, and the other one was you were talking about diazepam and the different drugs like that. People said right away during the class when we were teaching it, must be like heroin or cocaine you could die from. And it's not.
No.
It's the alcohol, the simple little alcohol, and the other drug we were talking about.
Sure. And heroin, I think when you use it, there's definitely more of a chance of overdosing on it and dying from that in the process of using it. But in the process of actually coming off of it, it's not as dangerous. It feels awful. It's like the flu 100 times worse than the flu you've ever had, but it's not going to be life-threatening. And so as a lot of times people decide to come off of alcohol, they think, I'll just do it on my own, I'll do it at home.
Very
and
dangerous.
yes, it can be very, very dangerous.
Yeah, that's interesting. I mean, that's, I think, something people need to see and hear to understand. You know, when I was teaching BASS, it's a beverage alcohol seller serve educational training to bartenders, waiters, or whatever, we talked about it and discussed it, that alcohol is a diluted poison.
Sure. Sure.
It really is. I mean,
and it's a
people,
central nervous system depressant, so it depresses your body, it lowers your inhibitions, it slows you down, it slows down your gait, it slows down your speech. And so when someone stops drinking, what really happens is you're used to being depressed, and now you're like, phew, I'm shooting right back up again, and that's what causes the high blood pressure and the seizures and things like that.
And I think when people understand that, okay, it's a diluted poison, understand what it is, you'll have a little more caution not to overdrink.
Sure.
You know, to have a alcohol poisoning basically to your system. Are medications considered chemicals?
Definitely. We see a lot of people, especially with opiate type of medication or narcotic medications for pain, like OxyContin, hydrocodone, Vicodin, codeine, things that you might get prescribed if you have dental work done or surgery done. And a lot of people take them like they need to, and they stop taking them when they need to, but others can become very easily dependent. And again, it's another substance like alcohol that our body develops a physical tolerance or physical dependency. And so even if I was prescribed a medication like hydrocodone for any period of time, I would become physically dependent. Your body's just made that way to do that.
Right.
It's then getting off of it and having more of a psychological dependence or the craving state, thinking I need to have this. And that's where people really get kind of caught up in the cycle of addiction, is when that they need to have it.
So to see these and to understand it, and what we can do is to see the physical things that happen in the body and other things that are happening psychologically to you for the chemical dependency. That's a whole nother almost a whole other program probably we could talk about just on those things. But we'll touch on those things. I tell you what, when we come back, we'll discuss those items of how to recognize if there's an issue. Is it physical, psychological, whatever it is? And we'll be right back and discuss that.
Big dreams and good grades aren't enough to get into college. There are actual steps you need to take. Finding someone who can help is the first and most important. For the next steps, go to knowhowtogo.org.
Everyone has friends. There's online friends, friends to go out with on a Saturday night, friends to hang out with and do nothing, friends who show up on moving day. And then there are the friends who'll be there if someone is dealing with a mental illness. Are you one of those friends?
Whatever we deny or embrace, for worse or for better, we belong together.
Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Welcome back to Mental Health First Aid. We're talking about chemical dependency, what it is, what it means, and controversial topic on gateway drugs. I know there's a lot of discussion about if alcohol is a gateway drug, marijuana could be a gateway drug. And we have Beth Sack here today from Linden Oaks, and we're going to discuss those things with her right now.
All right.
Beth, what do you think with alcohol? I mean, personally, I have an opinion on this, being a police officer for the 30 years and watching and teaching DARE and the different things that I've done. I believe alcohol can be a strong gateway drug. What do you think?
Sure. A lot of the adolescents and young adults that we treat, initially they kind of balk at that and say, oh, it's alcohol, or alcohol, marijuana, it's no big deal. And a lot of times if they come back into treatment at a later age, they really start to realize, well, if I didn't start with even cigarettes and alcohol and marijuana, I probably wouldn't have moved on to some of these other substances. So it's interesting just to see how their perception of that changes as they progress in their use, to realizing if I never started with that, I probably would have never ended up using opiates or heroin or something else.
And I guess why it's so hurtful, or they're so sensitive about it, because people who do drink and smoke and have no problems with it, they feel like, you're saying I'm going to do drugs then. I'm going to be in heroin in another couple of months. We're not saying
Sure,
that.
it doesn't happen to everybody, and not everybody progresses from one substance to another, but anybody who's progressed into further substance use, pretty much, I would say 99% of them can identify that they have drank and used marijuana pretty abusively at points in time,
right,
and then led into other substance use. I mean, when you start hanging out with people that are partying all the time and drinking and using all the time, you're going to be at some party and someone's going to say, hey, you want to try this? And instead of just alcohol and marijuana, now all of a sudden it's a line of Coke, it's heroin.
To get to the next level,
else.
a level of high or whatever you want to do from that point. We're talking about marijuana. Now, marijuana today is nothing like it was in the 70s.
Definitely not.
I mean, the police department, we used to get a subscription to the High Times magazine, and people hear that and go, what? We would get that to understand the trend, what was going on, the new ideas that were going on at the time, and it was really interesting. They would have pictures of marijuana in there that was so morphodite looking, so inbred.
Right.
I mean, it doesn't even look like a marijuana plant, and it's what we were reading there is 7 times stronger than it was in the 70s. It is now. So this is a serious drug now, a chemical dependency, and not just a psychological one, but a physical one now. Is that true?
Yeah, some of the research has showed that not just the psychological dependency, but more of a physical dependency of when they come off of it, being very agitated, having some kind of withdrawal symptoms. Typically, it's mostly to do with kind of agitation, irritability, maybe not sleeping as well. But people, and people have also identified almost developing a tolerance to marijuana, which again goes along with the physical type of dependency that, it isn't just a couple of hits anymore, a couple of joints. They need more than that to get the same effect that they're looking for.
Right.
So.
And lacing with whatever inside the marijuana, different things too. And you never know what you're going to get in stuff. I mean, you really don't.
Right.
What some of the trends that we're looking at right now, is marijuana pretty highly used? Or?
I think marijuana is still very highly used by a lot of our young adults. Some of the other trends we're seeing, because for a period of time it was illegal, legal, excuse me, and I think recently it's been made illegal, is kind of the synthetic marijuana, which is usually known as like K2 or Spice, or some of the names that people are most familiar with. And I do believe in January of this year, the state of Illinois has made that illegal. Any analogs close to the chemical structure are illegal now. And what had happened before was there was a certain chemical structure, and if they tweaked it just a little bit, then it was still a legal substance. And so you could just go to a gas station, a head shop, and just purchase it, and it was legal to do. So people have kind of started to do that a little bit more. College-age kids, even adults in their 30s and 40s have really, I'm surprised to find out how many people that are a little bit older are using that also.
And I guess it's something that parents need to be aware of and understand. If you're ignorant about bath salts or the different names they're putting in these things, and you're thinking it's an innocent thing, potpourri or whatever, they're using different things, you need to educate yourself and understand what these things are if the kids do bring these things home, or to see what they are and to understand
I have
them.
parents say, I remember when the synthetic marijuana was first coming out, maybe around this area, maybe a year and a half ago, and they said, oh, I was at a tobacco shop and my son bought this little packet of something and said it's legal, so it's fine, right? I'm like, no, that's not fine. So I think it's been a learning process too for a lot of parents.
Pretty scary stuff. I know we had talked about this, and I think we're going to do a separate show specifically on trends and the different drugs and different things that are happening. And we'll do a whole half-hour show just on that. So we're not going to touch a lot on it right now, but we're talking about another trend of heroin.
Yes.
Big?
Huge, huge. I don't ever want to go ahead and say it's kind of an epidemic, but it's definitely a big problem. And I think how people have looked at it is that it's in the city, and the collar counties are really where they've seen the most rise in heroin use over the last 3 to 5 years. I think a few years ago, Chicago area had the most ER admissions out of the whole entire country for heroin problems and overdoses.
Is there a reasoning for it? I mean, is it it's more pure now? You don't have to shoot it up. You just ways of using it.
It's cheap. It's actually very cheap, and it's fairly easily accessible. People just usually hop on what they call the heroin highway, which is 290, and head right down to the city and are able to buy it. And now they're starting to bring larger quantities back and start to sell it. And unfortunately, as the progression again, even just with this one substance, usually starts with snorting it. A lot of people end up injecting it. A lot of young kids that thought I would never do that, we see them in detox, and they're at a point of injecting it. And girls, females, we're seeing a higher amount of girls coming into treatment that are 18, 19, 20 years old.
Right. I know, I've known in my past with some different people who have had some problems with heroin. They use a illegal drug to try to wean themselves off of heroin, methadone. And surprisingly, they say that the methadone, they wish they would have never started the methadone, because now they're addicted to that, instead of getting off of it, weaning off of it, because that's a legal form to keep you at your level, to keep you going and stuff. I was sort of fascinated with that one. They were trying to help them, but it couldn't really, it made it worse.
There's certain people or certain population of people that would do really well on methadone, and other people that might not. So it's definitely an option that you might want to take a look at, but it's not for everybody.
So really, everybody's wired differently, and everybody handles things differently of how their system's going to handle it, and some things will work and some won't work.
Definitely.
We were talking about marijuana earlier. Is there any legal substance, pharmaceutical they pulled out of marijuana now? Marinol?
I'm not familiar.
Some type of a pill they're pulling out now called Marinol out of marijuana, saying that it can help for appetite.
Yes, I
to
do
bring
know.
back the appetite and something like that. It was interesting. I used to tell the kids all the time in DARE class, says, hey, if marijuana was so great, and you're breathing in this hot smoke into your lungs and holding this hot smoke into your lungs, it's supposed to be good for you? Come on, give me a break. It was so great, how come they can't pull a pill for them out of there?
Well, no, they have.
They have, and it has become a medical help in that aspect only, not in smoking it.
Right.
You know?
And I'm not as familiar with the medical marijuana, and I would say the same thing as the methadone. It could be something that could be helpful for a certain population with certain medical issues going on, but it's not something I'm as familiar with.
Yeah. I think what we're looking at a little bit closer is what specifically you guys do. You do the behavioral
Behavioral health, the detox, and the
the
intensive
detox
outpatient.
itself, and all the different aspects that you're working directly with the cognitive behavior, with all the different aspects of that. I think when we come back, we'll look at that type
Great.
of episode.
Sounds good.
So we have a lot more to talk about, a lot of interesting aspects of chemical dependency and how we can help and how you can help yourself. If there's something out there, first part of recovery is knowing there's an issue, and we're going to give you some highlights in that when we come back.
It begins innocently enough. You don't return a phone call. You break a date at the last minute. But in fact, it's the beginning of a pattern. And soon, your friend with mental illness realizes you're avoiding them. But what if you knew that your friendship was the key to their recovery? Would you still lock them out of your life?
I remember how much you said you liked wine. Oh.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
Ready. 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 Ready.
It can be a little awkward when your friend tells you he's been diagnosed with a mental illness. But what's even more awkward is, if you're not there for him, he's less likely to recover.
I'm here to help, man, whatever it takes.
Welcome back to Mental Health First Aid. Mental Health First Aid is a curriculum, a 12-hour curriculum that we can teach. We go out to police departments, we go out to fire departments, clinicians, anywhere, clergy, and we will teach this 12-hour curriculum to help you be a first aid responder, a mental health first aid responder, like CPR is. For the heart, this is for the lungs. So if anybody's interested in that, please contact myself at Linden Oaks and we will get you hooked up with it. But today, what we're talking about specifically right now is chemical dependency. And chemical dependency is one of the programs, one of the chapters of mental health first aid, and we're discussing about what it is exactly and what it does to the body physically and what to look for. And we have Beth Sack here from Linden Oaks talking about that, and we're looking at a little bit of the physical things that, and you said a tolerance can be built up. If somebody was on drugs, I mean, does each drug have a specific thing that would show? I mean, you'll be flush, you'll be this, you'll be that,
Sure.
or is it sort of a overview?
Some of them do, and I think how I would break it down mostly is what class they fall into. And so if we look at alcohol, that's more of a depressant. So you may see, again, slurred speech, slower gait, kind of that slowed down mode. Opiates are kind of fall into the same category. The difference with opiates that you see sometimes is what we call people on the nod, and they kind of be in conversation like we are, just kind of go like that, and then they're back in conversation again. So those are some things. And another one with heroin to really look at is pinpointed pupils. It's definitely something they can't hide. When we look at substance dependence, a lot of times they'll cover it up of, oh, my nose is running because I have allergies today, or I have the flu and that's why I'm vomiting today, and it's really withdrawal.
Right. I know one of the things that sort of remind people when you say pinpoint pupils, think of a needle.
Definitely.
Needle pinpoint heroin. I mean, it sort of gives you an idea of how to remember them, because it was, okay, if it's big pupils, small people, I don't remember, you know, what it means, but give you an idea, sort of a little cheater there. With alcohol, do you think, and I've heard people say this before, that there's a smell also that literally comes out of the skin,
Definitely,
pores,
from
and
the
stuff
sweating and from their pores, and yeah, a lot of times you can tell that someone's been drinking the last couple of nights or something, because you can really smell it, kind of that stale alcohol
And
smell.
I guess another thing to look at also with this sort of a rounded education, a fruity smell sometimes comes from the breath. They might act like they're intoxicated, but it could mean something else. Diabetes.
Sure.
If they're having a diabetic attack where they seem like they're intoxicated and they have a fruity smell coming out, we've seen this a lot at the police department, pulling somebody over and they just seemed out of it, and it was a low sugar.
Diabetic.
You know, we had to get the ambulance there real quick and take care of it, and I guess it's one of the things we have to understand also to look at.
Sure.
What are some of the things we do, I say we, I mean we, that we can help? How can we help?
I think just being aware, it seems, my experience over the last few years, especially with a lot of the young adults that we have coming into treatment, and a lot of them are using marijuana, but there's also a good number that are using heroin, is just their parents being aware. And a lot of times the parents have such guilt because they're thinking, how did I miss this? When they think my child's on heroin, that's like a huge deal to them. It is a huge deal.
Right.
And they're thinking, how did I miss this? And just being aware of, again, some of the earlier substance use, some earlier behaviors. Changing friends is a big part of it when we're looking at young adults. Being aware of some of the symptoms you might see is really, really important. And I think, unfortunately, a lot of parents just want to think, well, this isn't going to happen to my kid. And so they don't really pay attention to the education that's available and the information that's out there.
Right.
So I think staying knowledgeable is probably the most important thing.
I think I've seen also in some parenting skills sometimes parents sometimes try to be friends and not a parent.
Sure.
And that's a dangerous thing to do. I've seen parents admit to their kids that they've smoked marijuana when they were in high school and stuff. As far as I'm concerned, it's none of their business. You know, you made mistakes, whatever, in your past. You don't have to bring those up, because I can't tell you how many times I've seen the kids then throw that in the parents' face when the police officers get there and say, well, you said you smoked dope. I mean, what's the big deal?
Right. Right.
I think parenting is a tough job, and we have to be careful of how we do that and how we get the skills and keep it going.
Well, we're trying to start off, actually next week we're going to start, we're kind of looking at this population that we see, this 18 to 25-year-old population, and looking at them as emerging adults, that they're not really quite into adulthood yet. They're kind of trying to get there. And so we're looking at doing a lot more skills-based activities, even just how to budget, how to finance things, how to fill out an application for college, how to do a resume. Because in some of the parents we're talking to, they're feeling like they've done too much for their kids, and their kids just don't know how to do some basic skills that they need.
Interesting.
So
that the parents themselves didn't get to that level to help, so you're trying to teach them how to do some of the basics. Like, I mean, one thing that comes to my mind, is when we're teaching, and I always bring this up about DARE and stuff, but it's just my background. One of the things in DARE is to teach the child how to do a proper handshake.
Sure.
You know what I mean? It's sort of an important
basic.
skill to understand and what it means. It shows who you are, your assertiveness, and what's going on. So you're trying to do the same thing there to give them some basic skills to go along with.
Sure.
So some of the other things that you do, cognitive
behavioral therapy, CBT for short, and that's really looking at how your thoughts and feelings are tied into your actions. So if I have this thought or feeling that I want to use, how can I make the action not going back to using happen? And so just being aware of what some of your triggers might be, being able to sometimes sit with that and work through that, and realizing I don't have to jump to a certain action just because I feel a certain way.
Right.
And other times, sometimes those thoughts that you're even having aren't true thoughts or rational thoughts. They might be irrational thoughts, and being able to learn to identify what's irrational, what's rational, what is my perception, what isn't really kind of real at that point in time. And so that really helps them to be able to identify, because as we look at treatment of any substance dependency issue, it really goes back to their thinking issues. In AA, they have a slogan, it's a thinking problem, not a drinking problem. And that's really what it comes down to, is you take the substances away, there's still this thinking, there's still these personalities, these attitudes, and learning to adjust some of that is really, really important.
Interesting. With the detox portion of it, we have that portion that we handle also, and you oversee that. And you said it's very dangerous for alcohol and diazepam, two main
benzodiazepines, sure.
Yeah, the ones that are really dangerous that you could die from. So you oversee those things. Give me some ideas. What do they do? Try to go through detox. What do they?
Sure. First and foremost, in the detox unit, we want to focus medically and make sure that they're medically stable. And so we utilize some different scales to be able to tell in regards to what their withdrawal is like, and then we medicate appropriately based on kind of how they score on those types of scales. There's a scale for opiates and a scale for benzodiazepines or for alcohol that we use. And if they're scoring a certain way, we would medicate them to make sure that they're not, their system's not really going to go into the shock of, I have all this alcohol in my system to nothing. We usually use some benzodiazepines to help with that and wean their system off the alcohol. But we also like to get them up and in groups as soon as possible. So even though they might not be feeling the best, get into group, talk about it, learn some relapse prevention skills, learn some of the medical aspects of what's going on with you. Again, if they're really, really sick, we'll let them sleep and have a day where they can kind of rest, but we want them up and moving and getting involved as soon as possible.
Is there a key for detox for it to work? I mean, do they have to be at that point where they're at the bottom of the barrel and they want the help?
You know, there's other people that don't have to be at the bottom of the barrel, so I don't think there's an indefinite answer to that. To me, it's just it's the motivation, it's the commitment, and I think if people go through detox and don't do anything else, it's really not going to be that helpful.
Right.
And so following up with some other type of therapy, if it's just an outpatient therapist they might see, if it's going to 12-step meetings, if it's coming to a program like at Linden Oaks, intensive outpatient or partial hospitalization, which is 3 to 6 hours a day, Monday through Friday. I think what's great about the addiction realm is we have 12-step programs. It goes back to 1935. I mean, these programs have been around a long time. They're free, they don't cost anything, and they help a lot of people. Some people don't ever need to seek other treatment. They just go to AA or NA, which is Narcotics Anonymous.
And that works for them.
And it works for them. And I feel like in other mental health areas, they're a little bit behind the 8 ball, that they don't have those programs. I know they're developing them now, but those support groups are really what helps somebody to stay sober.
Support groups are the answer. It really is. And I think the support groups through family, through spiritual, through all the different avenues is what we really look for. Beth, I really appreciate you coming on the show and sharing some things with us. We're definitely going to have you back for our trends that are coming up, and lots of different scary things that are going on with that. But we are glad that you stopped by to listen. Mental Health First Aid is there for you. If you're interested in the curriculum, please give a call, and we'll get you hooked up with that class. But we really appreciate you being here and listening today, and we'll be back with another show soon. Thanks.